Deep sliding systematic palpation of the abdomen, the descending colon. Perform hand washing before the contact with your patient. Provide privacy. Prepare all the equipment on the procedure trolley. Greet your patient warmly and politely. Identify your patient. Take an oral informed consent. Explain all the steps of the procedure to your patient or family present. Ask the patient to undress to the waist. Use supine position of your patient for palpation. The room should be warm. Your hands should be warm. Cut your nails before the palpation. Sit on the chair. To the right side of the patient for the right-handed doctor, to the left side for the left-handed doctor. The chair seat is on the level of the couch. The patient is lying on his back, his head is lying low on the couch, his arms are stretched out, the abdominal muscles should be relaxed, and the patient's breathing should be calm, preferably with his mouth. Place your fingers, the second, third, fourth, and fifth, on the right hand together and slightly flexed perpendicularly to the axis of intestine, which runs vertically to the left lumbar region. The palm of the right hand is facing to the umbilicus. The left hand is placed under the left lumbar region, while the fingers of the right hand press on the anterior wall of the abdominal cavity until you feel your left hand. With a superficial movement during deep inhalation of your patient with the abdomen, the fingers are displaced medially and a skin fold forms in front of the fingers. Straighten the fingers of the right hand until the fingertips touch the posterior abdominal wall. At the moment then the patient exhales deeply. At the end of exhalation, the fingers slide along intestine. This is the technique: breathe in, breathe out, and palpation. Breathe in, breathe out, and palpation. Identify diameter, consistency, surface, mobility, pain, and rumbling phenomenon. Descending colon is palpated in the left lateral flank in the form of mobile, moderate, dense, painless cylinder near 2 cm in diameter. Assist dependent patient in dressing. Explain data obtained during palpation. Perform hand hygiene. Discard disposable equipment. Record the procedure in medical record as required.